Hey friends and clients, low back pain is so common. I would say that most of the people that come into my practice at some point in their life have experienced it. And anytime there's low back pain, even if there's some structural things going on or there's been an accident, it's always a good idea to get it checked and to see if your massage therapist might be somebody who can help you. A massage therapist can do so much to create relief in the soft tissue, and just that alone can reduce so much pain and inflammation and swelling and really help you get your life back, your movement back. And that's what I love doing for people, is to help them get relief. So what I'd like to do is show you a clinical approach to doing some work on the low back and how I use some of my tools and help people who might be having this kind of pain. So I'll switch to a close-up view. So one of the first steps with working with low back pain is warming up the tissue. So often we'll spend the first 10 minutes or so just working through the tissue, doing some muscle stripping, really getting those muscles to start to warm up and get some blood flow in there. Now I'm going to go a little quicker in this video so that you can get a sense of things, but any of these techniques I could spend much more time doing them and working with them. After the tissue is warmed up, we've got some movement in there. I've assessed things, see how well the sacrum moves as well. After we've done that, the next step is really going to be treating this big muscle that lives right here. It's called the QL, or the quadratus lumborum. And then we go in and we work and we do some deep tissue work, really opening that, relieving it with some big, broad, deep pressure, getting that to release and to relax. And we can hang out on this for a while. I add some movement to stretch the fibers, and this is how we start to open it up and get relief. Once this happens, I like to switch to using some of my tools. The next step is going to be to get some of these erector spinae, they're called, using the muscles that live right along the spine. To get some of these, we worked on this big one right over here. Now we're going to go right next to the spine, and to get some of these muscles to let go and release. So I'm using one of my T-bars, one of my tools, and I'm dropping right next to, here's the spine right there, dropping right next to the spine and scooping down and in and really helping those muscles separate and spread off the spine. When the low back gets tight, these muscles that live right next to the spine, it's like they squeeze and they go right against the spine and lock up. So we're trying to unzip them, almost like unzipping a coat or something like that. Here we go. Dropping in, giving them time, really unzipping all those muscles. And again, we could spend lots and lots of time on this. But for now, you're just getting a feel of how I approach this. Good. Once this starts releasing, I like to come back to the QL and do a little bit more specific work. I'm using a different tool now. So before I use the big broad, now I'm going to use something more specific. And so this way we're starting to go from global release of that muscle to specific release. And this is where it starts feeling like, wow, oh thank goodness. Things start opening up deeply through this type of specific work. So you can see I'm changing my angle, I'm working with all these different fibers, really so that the whole aspect of that QL can start releasing. Once we're effective with that and that starts to let go, I like to switch over to a different tool. This is the wedge, and I'm going to start working on some of those things under the hip crest. It's like where the low back really connects into your hips. So this is how I'll drop in here, and I'll start to work right on those attachment sites and release that, where those muscle turns into tendon and attaches right to the hip crest. Good, and we work all the way out, all along the hip crest, all along the ilium. Good, and you can see I'm going slow. I'm trying not to go faster than the tissue really wants me to, following the opening of the tissue. Good. After that happens, we can even come in and address some of the ligaments right in here. Here's the spine, here's the hip crest, working right into some of those ligaments that attach the hip crest into the sacrum. right in there. They can get so tight. Good. At that point, I usually like to do a little more mobilization. We've got some tissues released, and now we're really opening things up and getting some good blood flow. You might even see, I don't know if you can see on the video, but especially where we did some of that QL work, there's starting to be some red at the surface. Things are warming up, and that's good. That's exactly what we want. Now, for those with disc issues or for chronic pain, once this really opens up deeply, there's a next step, and this is where the work gets really sophisticated and powerful. I'll use this T-bar. This is the Baby Bell. Let's see if you can see it better. There it is. Got that really clear, really small tip there. Not clear, but you can see it's very specific. And so what you'll do with this, what I do with it, is I go in and I'm working very deeply to these little muscles that live between the vertebrae, the intertransversarii. Now, people hardly ever work on these, and they're so important. If you can imagine them on either side of the spine, if they tighten, they're going to squeeze the disc and really compress and cause bulges and things of that nature. It can really play into those types of symptoms and pathologies. So here I am dropping down and in really slow. I'll start by going vertical, and then you'll see me start to tilt out horizontal and head towards those little tiny muscles in between the vertebrae. Now I would have spent much more time warming up and getting you to this point of this really deep changing work. This is the type of work that clients will leave and they'll tell their therapist, usually I'll get relief for 1 day, 24 hours. When you get down to this kind of level, this is where people see relief for weeks or even longer. This is like structurally changing the tissue, and so impactful. All right, thanks so much for watching, and I hope this gave you some ideas about how I approach low back treatment. Take care.